Everybody, a really warm welcome to this week's PPMA webinar. I hope everybody is well, and thank you so much for joining us today. I'm your host for today, so my name's Andy Dobman and I'm one of the Vice Presidents for PPMA. My day job is the Chief HR Officer for Leeds City Council, and I'm really pleased to be joining you today and hosting today's session. So today I'm really delighted that we are covering a really important theme, a really topical topic to cover over effective mental health and improving workplace wellbeing. I'm really pleased that we've been joined by Nuz Chagan, who is the leadership team member for Let's Improve Workplace Wellbeing and is Head of Wellbeing Strategy at Govox. I think what we'll do is Nuz will probably talk for around 25 minutes or so, and if we've got time, we will do some Q&A for Nuz at the end. So please do use the chat functionality, and we'll try our best to pick those up at the end. So warm welcome to you, Nuz. It's great that you've joined us. So welcome, and over to you.
Brilliant. Thank you so much, Andy and Grace. And it's really superb to be here this afternoon to discuss this. So I'm going to head straight in because thank you for the kind introduction. I wear two hats, Head of Wellbeing Strategy at Govox. So this is a very crucial topic for us because, of course, we always say we want to look behind the brave face, and it's about building those, I guess, fences around cliffs before people actually drop off them. So it's really essential for that. Just moving on, I just thought, please do use the chat function, put in your name, your organization and your role, and just add in any questions and feedback because it will help us in order to, perhaps if we don't get them onto this session, we definitely can, come back to you later. And then moving into just understanding, who and what is Let's Improve Workplace Wellbeing. We started off pre-pandemic, I guess, and then moved into the pandemic purely because we saw a need, and in particular around financial well-being and how do well-being leads actually get together, because it's quite silo sometimes. They kind of get on with their jobs in isolation. How do we create a safe space where they can really learn and share from best practice, but also be able to find what's coming next? How do they build up their competence and buddy up with some of the well-being leads that are actually out there that have been in their roles for quite some time? There is no roadmap today for well-being lead. If we look at it, CIPD integrates it into some of the modules, but actually when we look outside, there isn't somewhere that you can actually go and where you've inherited a position where well-being is under your remit to actually then understand which indexes do I need to look at? What does my role actually entail? How do I deliver? How do I influence, etc.? So this is where we've brought everybody together to try and support that agenda and take some of these discussions. It's not a place of judgment. It's just purely for people to come together and say, this is where I am and this is where I want to be. So help. And then just moving on to just gauging and, it's possibly a poll, but we don't want to take too much time on this. It's generally in the chat or even just using your reactions. Do you have mental health first aiders only in your organization? Are your wellbeing champions also mental health first aid trained? Or do you only have wellbeing champions? Now, there is a differentiation between all three because some wellbeing champions are purely there to send out messaging. And then some, it's okay if you don't have any of these at the moment and you're still on that journey, that's completely fine. But please feel free again to use the chat because as much interaction there is there can really allow us to understand what the situation is. And then really looking at well-being and learning from others. So much of what I'm going to talk about today is not just me knowing everything. I don't. I've been in the wellbeing space enough times. I was former head of wellbeing at IKEA. I've been out as a consultant in terms of wellbeing strategies and understanding mental health in particular. And I've had that time to actually understand the market. But really, I grow because I'm well connected to a lot of these incredible wellbeing leads. So we have sector specific sessions that we run because we know what happens in councils and public sector is not necessarily what happens elsewhere. So in one of our first sessions, it's facilitated by Dr. Sabrina Robinson from Essex Council, and we've got Liz Mahal Brewer from Surrey Council, and they facilitate it. And we do this in terms of a discovery session. And the purpose of why I kind of put forward this topic around is mental health, and first aider training a tick box exercise, and how do we actually move it, is because it was one of the key topics that came up. You have Norfolk Council that have been doing it, pre-pandemic for 3 years, and then you've had some of the other councils that are just starting or embarking on that journey. So it's really about sharing and understanding from grassroots levels right up to where people have embedded and really enhancing their mental health strategy. How does it actually work? So feel free after the session, if you'd like to join that one, it's on the PPMA website, and you'll be able to really come to that one. In this next session, we'll be looking a lot at the good standards for workplace wellbeing, and also looking at, how are different wellbeing leads within council and public sector actually benchmarking themselves. So how are you checking what's good versus, what's better? So a really interesting conversation there. So now moving into the discussion of today, from tick box exercise to effective mental health. So to start off with, it's really understanding what is mental health first aid. It's the mental health equivalent to physical first aid. And the training provides participants with the skills and confidence to really recognize the symptoms of common mental health issues. It's to provide first aid support to someone experiencing a panic attack or having suicidal thoughts, and it's effectively to guide a person towards the right support. The reason why we start there is really to understand how many times have mental health first aiders gone on a training, returned back, and their manager has asked them to actually debrief and then discuss a plan of how to practically apply what they've learned during the course. That doesn't happen across the board, and that's something that we're trying to encourage. There isn't actually a problem with mental health first aid training. I think the issue is about how those who become actually certified are able to develop their skills and make that real change in the organization or real difference when they return back to the workplace. So in terms of that, that's what we're trying to set the scene on. For me at Govox, what I try and always talk about, and I guess this is different people will use different terminology, yeah, it's around how we connect, identify, and support when it comes to mental health support. So that doesn't matter whether you have mental health first aiders, whether you have wellbeing champions. The roadmap is very much the same thing. It is about how do you connect with this community of mental health first aiders, stroke wellbeing champions, and support them and constantly evolve them in order to take these steps that they need to take. So we talk about connect, identify, support. Others will talk about insight, accountability, support. It's how you look at it, but it's really essential that mental health first aid, in order to move it from being this tick box exercise to effective mental health, is really ensuring this continuous support around managers or mental health first aiders or wellbeing champions, in order to create this clear expectation of what really needs to be done. And then we come to a piece that I thought this is just a vital graphic. It's a graphic of the different ROI that you can experience through different approaches to tackling well-being. Essentially, it's an integrated campaign and where you are considering the insights and details about what is going on for your team. It's a piece of, I guess, evidence-based from Deloitte's research. It's pre-pandemic. There isn't any global data at the moment. They're working on quite a lot. But when approaching mental health in relation to well-being strategy, it's not just to rely on mental health first aiders as the sole pathway to success. You have to consider certain questions, not only about the support and how you develop them, but I know for a fact I get asked often, how many mental health first aiders should you have? How often should you retrain them? So for example, they should get support on a continuous basis, feel that they are supported in order to support others. And that when we're looking at mental health first aiders in organization, the recommendation is that you should have one mental health first aider to at least 15 to 20 employees. And it's really essential that you have the communication and the visibility on a continuous basis. I've taken an example from E.ON purely because they've really done a lot of work. And it's quite interesting when you speak to Louise Boston, who's head of Wellbeing at E.ON, in terms of how hard it is really to do this job. They've been in it for 10 years. So, you know, at this point, it's important for us to celebrate where we are. There is no right or wrong. There is no organization that can claim they've got it absolutely 100%. The key is that we have to work together, collaborate, and learn from one another in order to really, you know, move things forward. We have to really understand what the problem is in the first instance. And I always take the avenue of, if you are going down the route of tick box exercise, that's okay as well. It's not to criticize it. There may be a lack of resource, there may be a lack of budget, there may be a number of reasons as to why you have to do that, and you're trying to do something. But too often we jump in and think we will get a few people trained up and they will just suddenly take over this and they'll lead without doing the due diligence piece. And I guess looking at the mental health strategy from E.ON, it's a really good example to look at how they approached it. You know, they identified the business need, they understood the value proposition. Stakeholder management is so crucial. This doesn't exist just in one area. I mean, even when I look at the Norfolk Council example of how they've worked, it's about that cross-functional working together, because it doesn't only impact, I guess, the wellbeing officers or the pay review manager or the HR director. It's about how you bring that across all the different directorates. They talk a lot around culture, consultation, and engagement, because again, mental health first aid is not there to tick a box in terms of, yes, we've got them. They're the ones that are going to solve our mental health issues within the organization and put a plaster over the cultural impact that a workplace may have. It's really, how do we create that? Marketing and branding is really an essential one when we talk around your mental health first aiders, to really move it from tick box to, you know, actual active. There's some organizations that say we've trained up X number of people and we're not getting anyone speaking to them. You know, really digging deeper into that is what a lot of the successful ones that have done this have done it well. Really understanding resource, the outcomes, and the impact. I guess it's quite interesting to look at E.ON as an example, because they've made a conscious decision not to necessarily train their people up by the mental health first aid training. They've embarked on, I guess, working on a long haul plan, and that is to constantly, you know, be upskilling the number of people they have. I guess their take on mental health support in the workplace in general is, how do you get visible and committed leadership? How can you be more innovative? And you really need to think of evidence-based best practice. So it's not to take mental health first aid and go, yes, we've ticked the box. It's about, how can you see what you are doing is going to give you the return? How do you make your strategy relevant? And as you can see, there's lots of things there. Take pride in your mistakes and accept it's going to be frustrating, but it shows you learning, and really be prepared about the long haul. I've just put in a summary, I guess, of a discussion that we had with Louise, and I'll be able to share at, you know, when the recording goes out, a session that she recorded with CIPD around how their journey has been, and a lot of where the inspiration has come for this. I guess in the step one, when we talk about this moving from a tick box exercise to really effective, is that they've got a plan. They know exactly how this roadmap should look. So they've got a stringent application to be a mental health first aider, or a well-being warrior in their case. It overlaps both physical and mental health. And it's stringent because it's not enough to just have someone that has had lived experience come forward. You do need to see that the person is able to take on more. The step two of it is they've ensured that the line manager supports their mental health first aider or well-being warrior. It's really to agree time out to do the role, because there is a lot that you're asking of a mental health first aider. Step three, they create a term of reference, really clear expectations, and they are there to signpost and not solve the problem. They talk about a confidentiality agreement. You know, it's not often that I've heard that come into play. An induction program. They agree on how and where they will engage, and agree on what they are there to do. So very clear expectations again. And then they're constantly upskilling to follow up. So they have a tactical way to manage and maintain and minimize risk. And then if we look at the bigger picture around psychological safety and all the work associated to ISO 45003, and you look at what is being done here, it is all working and moving towards that direction. How are we taking care of the mental health agenda in order to also align to the ISO 45003, but also really taking seriously that we are committed to psychological safety in the workplace? We always talk about the outcomes because, again, from tick box, if you want it to be effective, you need to be proactive in it. This is a snapshot of what they have done. And I'm not going to go into a lot of it because I will be sharing some of these slides, and these slides are open to share. You know, they've dedicated over 1,000 hours. You can see it's all very much aligned. But where I wanted to focus on here is that there's also support from mental health into other areas as well. So it has helped to identify, you know, issues around the workforces that, you know, are experiencing menopause. They have adaptability and embraced that, you know, as to, you know, when we talk about mental health, it can be quite diverse within it. What problem are we trying to solve and how do we help it? And then they've got different areas of engagement that they use. The interesting thing is that they can actually see the ROI, and they've seen the benefits in prevention of sickness absence, reduction in stigma, promotion of inclusion, and then the positive impact on the group in total. And they can see it in the surveys that they're doing and everything. But as you can see, it's very clear in expectation. If I take the E.ON example, and I also relate it to some of the work that's being done by Lee Wolcott Ellis from Southeastern Rail, he's done very much similar and taken the same roadmap that Louise has at E.ON. And what you can see is when it's a continuous loop, rather than just putting in someone in as a mental health first aider, you can actually see a much more better return on investment. He's gone a step forward in, yes, not just looking at sickness absence, and that he's actually got a real return on investment in terms of monetary. And that's where we all want to be getting to. We often say there's no budget for well-being. What we are trying to do within the workplace well-being space is how do we create the right metrics that we can then gauge and then show the return on investment so we can get the well-being budgets in place, because really that's what we're trying to do. A really essential thing that has come through a lot of this work on, you know, moving things from tick box exercise to really effective strategies is all around what metrics we are using, because a lot of the time people are using different metrics. So there is some alignment to some of that. If I move on to the example from Norfolk Council, lots of conversation, and I will try and engage if there is some appetite down the line to try and get them in to actually just do a session on how they've done things, or perhaps just some of their good practices. But it's quite interesting because, again, looking back at E.ON or looking back at you know, I guess the work done elsewhere, really effectively what they have said that is manager training, and it's rolled out as mental health first aid to really allow their managers to be confident to take those conversations, because they are often the first point of call. They tend to do the one-to-ones, and there's a lot of expectations on managers, but often we don't equip them with the right tools to do the job. So what they found is, how do you take these conversations? The training for mental health first aid is mandatory for all their managers, but that can have mixed feelings. But what it did ensure is that there was a message from the organization to say this is important. What they have found in terms of their value on investment is it's given the confidence to their peers that, or their managers, that there's a consistent message across the organization, but also that in taking feedback, they've seen that their managers are actually feeling that it's working. They feel much more confident to take and ask and identify and take that initial, you don't seem your normal self. The important thing for them was around senior leadership buy-in. They have the head of pay services, for example, that messages out to the leadership team and the manager team on a constant feedback loop around how to take steps to self-care, so that support for mental health first aiders is in place, but also to really think about how important it is to support the people within the organization. So that continuous feedback loop is really what we're trying to look at. And then I'm going to just end off to say that, of course, we don't have as much time today as we normally do. I think often we can take up to, I think in the region of an hour on this topic. So if you are interested, please do sign up to the 13th of April session. We'll have a little bit more time there. And as I said, it's a bunch of us coming together and really then taking one topic, unpacking it and seeing the best practice. So I've left a little bit of time, I think, just for any questions or any burning things that need to come back.
And thank you so much, Nuz, for that really thoughtful presentation. I'm very grateful for your insights and expertise. I guess sort of observations from me, because it's really interesting to hear about how, as HR practitioners, we can build on mental health first aiders from, if you like, that one-dimensional tick box approach to build on it with that connectivity to culture, impact, strategy, the ROI that you mentioned. And that is hard. So it's really useful to hear the case studies in terms of others who have done that. I guess quick question for me, because we do have about 5 minutes or so, is one of the questions we get from leads with our mental health first aiders is, you've got a population of trained first aiders that want to develop their in-depth knowledge of mental health and perhaps learn more about it, from a more specialist sort of acute mental health, or going to, say, a suicide prevention course. And you've got others that actually want to not do the depth but the breadth and want to get more involved in well-being more holistically, so financial well-being and social well-being. So I suppose it's getting your insights, Nuz, as to what's the best way. Do you encourage people to do the depth, or do you want your first aiders to go with the breadth, and whether you've come across that with E.ON or Norfolk, and any observations on that?
Yeah, I think this is why it was quite interesting to look at the exercise of E.ON, because the way that they've done it is they've not almost siloed everyone to go into mental health specifically only. They have overlapped with physical well-being, because what they find is actually when you look at the stress factors that go towards why someone has mental health issues, you'll see physical or financial springing through. And a big conversation right now is the financial stress that's causing sleepless nights, etc. So you've got a physical, which then is causing a mental. People are not as present perhaps in their roles. So I think in some of the examples is, I guess it evolves, and we do this in any role, don't we, where people have the most, where they feel their purpose, where they feel they can make the difference. Maybe perhaps it's doing a combination of the two. Is how do some become your well-being warriors, to take a very generalist view, and then how do you upskill some that are very specialist in mental health? I think the example again, looking at E.ON, or looking at I guess Lee Walcott's example, is that the ones that are specialized and wanting to upskill tend to create an avenue for themselves. So upskill them, because again, we're trying to be very preventative. This is why it's not about that tick box, but the holistic approach. We're just really trying to build that fence. And I think you can have the combination of the two.
Brilliant. Thank you very much, Nuz. Okay, colleagues, please do put any other questions in the chat functionality. Debbie just mentioned about the E.ON's mental health strategy, whether it's available to view. And also, I guess, Nuz, whether there's probably other really good examples that you would like to signpost us to, that we can live and learn a little bit more from. You've obviously mentioned Norfolk and E.ON, whether there's others as well that you want to reference.
Yes, so at Let's Improve Workplace Wellbeing, we're going to be doing a session with, as I said, with Southeastern Rail, Lee Walcott Ellis, because he's, as I described, has gone a step further than, I guess, a lot of wellbeing strategies. At the end of the day, we have to be realistic about wellbeing. We have CFOs, or we have people that are controlling purse strings. We have to show return on investment, and there's no point running away from it. Let's just learn how we need to take that conversation. And I think there will be some of that. On the question on E.ON's mental health strategy, is it available to view as an example? Absolutely. There are some slides and, as I said, a YouTube video. And Louise is very open to share some of that, because she understands, she's had 10 years of this, and she's very on par on how we work. And sharing is really going to help all of us.
Absolutely. Thank you, Nuz. Just back to your point about that sort of return on investment, and you're right that you're often challenged, aren't we, from finance directors as to, demonstrating the measurements of success. From your experience, if is a one metric, if we can only use one metric to demonstrate the impact and success, what would you say it should be?
So it's quite an interesting one, because if you're starting out, the way that we look, there's kind of 3 phases of well-being strategies. If you're starting and you're looking to, just start to implement, and then you move to embed, and then you're enhancing. Probably if I was having a conversation with someone at enhanced stage, I wouldn't be saying what I'm saying now for implementing. I think dig where you stand. I think if there was one or 2 or 3 measures, I would say is you are sitting on a plethora of data. What we did in IKEA is we just went to look at absence. But I'm not saying just to look at the metric of absence, it's everything that surrounds the metric of absence. How are you doing your return to works? How are you plating, the return to works, and actually understanding when people are registering, and something as simple as saying, I'm having a mental health day, or I'm struggling with my mental health, which has opened up much more. Whereas previously someone would say, my stomach is sore, or I don't feel very well. So I think in terms of that, if you are starting off, probably the consistent measure that most people are looking at is looking at absence. I would look at other data as well, because often your service providers lean on them to give you some of this data, and then you need to look at it and go, which ones am I going to pick in order to then try and move? And that's the simplest way, because not everybody's at the same level. So that's what I would say.
Yeah, no, thank you very much. And that, hopefully that helps you as well, Liz, because you've asked the question too, regards to measures. So thank you for that answer, Nuz. I'm very mindful that we've only got a minute left. So unless there's any other absolutely burning questions coming up on the chat, then we will come to a close. I don't think there is. The good news is, Nuz, you're going to join us at the PPMA conference at the end of this month. So colleagues will have another opportunity to talk to you more and listen to your experiences more, which is fantastic. So if colleagues haven't booked onto the conference, please do. So Nuz will be there, as will others. So that'll be really useful. I think you've also mentioned us that the slides will be made available from today. So colleagues will have a chance to look at those, which is great. So if I can just thank you again, Nuz, for all your time and expertise. Really appreciated it. And we look forward to hearing from you again at the end of this month. And thank you everybody else for joining us today for the PPMA webinar. I really appreciate it. And I do hope you have a good rest of the day and a good weekend. So take care, everybody, and we'll see you soon.
Thank you.
Thank you.